Imagine the following situation, which unfortunately happens every day in geriatric clinics. An active person around 70 years old begins to show worrying memory lapses, disorientation within their own home, and profound apathy. The family, desperate, believes that the dreaded diagnosis of Alzheimer's or senile dementia has arrived. Fear takes over, independence is taken away, and sadness sets in. But in many cases, when a specialist reviews the patient's history, they discover something surprising. It's not a degenerative disease. It's a silent intoxication. That elderly person was, in fact, suffering from a chemical overload caused by the combination of common medications they had been taking for years. This story is an urgent warning for you. Most people over 60 don't know that many of the symptoms they resignedly accept as things of old age, extreme fatigue, dizziness, forgetfulness, are cries for help from a body that can no longer process so many chemicals. Today, I'm going to show you how to identify the subtle but dangerous difference between natural aging and the signs of drug toxicity. There's a phenomenon called polypharmacy, which occurs when we use 5 or more medications simultaneously. And I'm not just talking about prescription drugs, but that sum that includes blood pressure medication, cholesterol medication, sleep aid, back pain medication, and even that antacid you buy without a prescription. The great promise of this video is to give you back control over your vitality. By understanding what I'm going to explain, you'll have the knowledge necessary to talk to your doctor, reduce what we call the cascade of prescriptions, and most likely regain a mental clarity and physical energy that you thought you had lost forever. Before we continue, answer quickly in the comments so I can get to know the profile of our community. How many different pills do you take per day? Just the number. This is crucial for what comes next. To understand why this happens, we need to look inside your physiology with honesty and science. The body of someone who is 50, 60, or 70 years old doesn't function at the same speed as a 30-year-old's body, and that's natural. The central problem is that medication dosages often don't keep up with this change. Think of your liver and kidneys as the filtration and drainage system of a swimming pool. When we are young, this filter is powerful and quickly cleans any impurities. However, pharmacokinetic studies show that at age 70, blood flow to the liver can be 30% to 40% lower than it was in youth. This means that the enzymes responsible for breaking down medications work more slowly. The result, that pill that should stay in your bloodstream for 8 hours ends up staying for 12, 16, or even 24 hours, accumulating with the next day's dose. Beyond the liver issue, there's a decrease in the glomerular filtration rate in the kidneys. It's as if the drain is partially blocked. When the kidney filters less, the chemical substance continues circulating in your system, reaching toxic concentration peaks that the doctor didn't foresee when prescribing the standard adult dose. This generates dangerous interactions that mimic serious illnesses. Alarming statistics indicate that adverse drug reactions are one of the main causes of hospital admissions in the elderly, often surpassing the very diseases that the medications should treat. The risk of falls, for example, becomes exponentially greater. You may be feeling dizzy, not because your labyrinthitis flared up, but because the mixture of 3 different medications has artificially and dangerously lowered your blood pressure. Now that you understand the mechanism behind this intoxication, let's move on to the practical part. I've prepared a list of the 8 most common signs that your body is overloaded. We'll start with the physical signs, which seem harmless, and move on to the neurological signs that are often confused with dementia. Pay close attention, because item number 6 is the most frightening for families, and number 8 reveals a vicious cycle that you need to break today. The goal here is not to make you stop taking your medication on your own, that would be irresponsible, but rather to equip you with information to seek the fine-tuning that will bring your health back. Let's start with the first sign, which most people confuse with laziness or lack of willpower. The first sign on this list is perhaps the most unfair of all, as it labels the elderly person as listless or lazy. Fatigue that doesn't go away with sleep. I'm not talking about that pleasant tiredness after a day of activities, but a feeling of heaviness in the body, as if you were wearing lead clothing, accompanied by excessive daytime sleepiness. Often family members comment, "Grandpa just wants to sleep," without realizing that this can be a red flag for liver problems. When liver metabolism slows down, medications that should be eliminated within A few hours remain active in the bloodstream, creating a cumulative effect. It's as if you took a new dose before your body has gotten rid of the previous one, keeping you in a constant state of chemical sedation, taking away your will to live and interact. The scientific explanation for this lies in the prolonged half-life of central nervous system depressant drugs. If you take a muscle relaxant, an anxiolytic, or certain analgesics, and your liver isn't clearing these substances at the ideal rate, the sedative effect is superimposed. What was supposed to last 8 hours ends up lasting 16, adding to the dose for the following day. The practical instruction here is simple but powerful. Monitor your peak sleep times. If you notice that drowsiness is uncontrollable 2 hours after taking your morning medication, write it down. Take this information to your doctor, as adjusting the timing or dosage may be enough to wake you from this induced coma and restore your energy. Moving on to the second point, we have a symptom that most people ignore, thinking it's just dehydration, dry mouth, and blurred vision. It may seem like a minor inconvenience, but it's a classic sign of what we call the anticholinergic effect. The constant feeling of thirst, difficulty swallowing dry foods, or sudden blurred vision, making reading or focusing difficult, are warnings from your body. The importance of this goes beyond discomfort. Dry mouth impairs digestion and dental health, while blurred vision drastically increases the risk of tripping and household accidents. If you always have a water bottle in hand and nothing helps, check your medicine cabinet before blaming age or the weather. This phenomenon occurs because many classes of medications, including common allergy medications, some antidepressants, and medications for urinary incontinence, block acetylcholine receptors. Acetylcholine is a vital neurotransmitter not only for lubricating mucous membranes, but also, and this is crucial for you to know, for memory and learning. Therefore, a high anticholinergic load doesn't just dry out your mouth, it can be drying out your mental agility. The practical solution is to have a review with your specialist focused specifically on medications with a high anticholinergic load. Often, there is a modern therapeutic alternative that doesn't cause this blockage, restoring your comfort and visual clarity. Before we move on to the third item, which is the #1 mechanical cause of hip fractures in the elderly, I want to take a quick pause. If you've ever experienced this unexplained fatigue or constant dry mouth and never associated it with your medication, please give this video a like now. This simple gesture helps YouTube understand that this content is vital and can save the quality of life of another person in our generation who is suffering without knowing it. Also, make sure you're subscribed to the channel, because the information I'll be sharing in the following points, especially about mental confusion, is liberating. Done. Let's continue to the sign that puts you at risk every time you stand up. The third sign is dizziness upon standing, technically called orthostatic hypotension. You know when you're lying down or sitting watching TV, and when you get up to go to the kitchen, the world spins, your vision blurs, and you need to lean against the wall to avoid falling. This is not labyrinthitis most of the time. It's a failure in blood. Pressure regulation caused by drug interactions. This is one of the most dangerous moments of your day. A young person's body adjusts blood pressure in milliseconds when they stand up, fighting gravity. In a medicated 50+ body, this response may be chemically blocked, leaving the brain without oxygenated blood for a few crucial seconds. Science explains this by the dangerous interaction between diuretics, which remove fluid volume from the blood, and vasodilators, which open the veins. When combined, they can lower blood pressure excessively at a time when your body needs to raise it to compensate for the change in position. If you take medication for hypertension and feel this, you are not sick, you may be over-medicated. The actionable instruction here is vital. Measure your blood pressure sitting down, then immediately stand up and measure again after 1 minute. If the pressure drops significantly, for example, the systolic drops 20 points, take these numbers written down to your doctor. This proves that a dose adjustment is needed before a drop occurs. We've reached the fourth item, which is often confused with serious heart problems, unexplained swelling in the legs, or peripheral edema. You notice that at the end of the day, your ankles have disappeared and your feet look like loaves of bread. And even when you elevate your legs, the swelling persists. The immediate fear is that your heart is failing or that your kidneys have stopped working. Although these conditions need to be ruled out, it is extremely common for this swelling to be a direct side effect of certain medications, specifically calcium channel blockers used for high blood pressure or some non-steroidal anti-inflammatory drugs, NSAIDs, that you take for chronic pain. The mechanism here involves a change in the permeability of your blood vessels and in how your kidneys excrete sodium. The drug forces the small vessels to relax so much that fluid leaks into the surrounding tissues, accumulating due to gravity in the legs. The difference from a heart problem is that often this drug-induced swelling is not accompanied by shortness of breath. The practical solution is to create a timeline. Check if this swelling started or worsened a few weeks after introducing a new blood pressure or pain medication. If the answer is yes, talk to your doctor about the possibility of changing the class of medication, and this becomes even more important when you understand the next point, which affects your intestines and can cause severe mental confusion. The fifth sign is often suffered in silence and treated only with laxatives, without investigating the cause: sudden digestive problems, alternating between severe constipation and diarrhea. I'm not talking about when you eat something that doesn't agree with you, but about a sudden change in your intestinal biological clock without you having altered your diet. The relevance of this is extreme and little discussed. In the elderly, severe constipation can lead to a condition called fecal impaction, which in turn releases toxins into the blood and can induce a state of acute mental confusion known as delirium. A sluggish bowel is not just abdominal discomfort, it's poison for the brain of those over 60. The science behind this points to medications that paralyze peristalsis, the natural movement of the intestines. Opioid analgesics, poorly dosed iron supplements, and certain antacids containing aluminum or calcium are the main culprits. They block the digestive system. If you started having trouble going to the bathroom soon after starting treatment for pain or anemia, the practical solution is not just to eat more fiber or take laxatives that irritate the mucosa, but rather to differentiate the effect of the medication from the diet. Talk to your doctor to find formulations that are less aggressive to your gastric motility, preventing a physical problem from becoming a mental one. Now we come to the sixth item: brain fog and pseudo-dementia. This is undoubtedly the most dangerous and emotionally devastating sign of all. It refers to recent forgetfulness, difficulty finding the right word in the middle of a sentence, or spatial disorientation in familiar places. The patient and family, frightened, immediately associate this with Alzheimer's. Panic sets in, appointments with neurologists are scheduled, and the elderly person begins to say goodbye to their autonomy, believing that their mind is fading. But here's the turning point that can bring hope. In many cases, this is completely reversible. What occurs physiologically is drug-induced neurotoxicity. The aging brain has a more permeable blood-brain barrier and receptors that are much more sensitive to psychoactive drugs, especially benzodiazepines, sleeping or calming medications, and hypnotics. What in a young person would cause only mild drowsiness, in the elderly can shut down essential cognitive areas. Science calls this pseudo-dementia because the symptoms are identical, but the cause is not the death of neurons, but rather their numbing. The brain is there, intact, but it is drunk on medication. The practical instruction for this point is what we call the assisted deprescribing test. If memory fails before accepting a diagnosis of dementia, it is essential to review with a geriatrician the possibility of gradually withdrawing or reducing sedatives and psychotropic drugs. If, upon withdrawing the medication, memory returns and the fog dissipates, it wasn't Alzheimer's, it was intoxication. Knowing this takes an enormous weight off the family's shoulders and restores dignity to the patient, proving that old age didn't take away their lucidity, but rather the chemicals that hit it. And this leads us directly to the seventh sign, which affects your personality: abrupt mood swings and apathy. You or your family members notice irritability for no apparent reason, easy crying, or conversely, a total lack of emotion, a numbness where nothing brings joy anymore. Frequently, this condition is diagnosed as late-onset depression, and the standard response is to prescribe antidepressants. However, adding another chemical to a brain that is already struggling to balance itself can only deepen the problem, creating a cycle of artificial sadness. Scientifically, this happens due to drug interactions that affect the regulation of neurotransmitters such as serotonin and dopamine. Medications that treat purely physical conditions, such as beta blockers for the heart or corticosteroids for inflammation, have the known side effect of altering mood, which can cause mental fatigue and depressive symptoms. The practical solution is to do a chronological analysis. Assess whether this emotional symptom or this deep sadness arose a few weeks after you started taking medication for your heart, blood pressure, or pain. If the dates coincide, the treatment for your depression maybe changing your blood pressure medication and not adding an antidepressant. Finally, we arrive at the eighth and final item, which ties everything we've discussed so far into account: the cascade effect. This isn't just a symptom, it's the mechanism that perpetuates your suffering. The cascade effect occurs when you take a medication to treat the side effect of another medication. Without realizing, you're creating a toxic snowball effect. It's the definitive sign that your health Management has gone off track and entered the autopilot of overprescription. Let me give you a classic example to help you visualize. You take an anti-inflammatory for knee pain. This medication upsets your stomach, causing gastritis. The doctor then prescribes omeprazole for your stomach. Continued use of this gastric protector hinders the absorption of vitamin B12, causing mild mental confusion and tingling. To treat the tingling and confusion, they prescribe a vitamin complex and something for circulation. Suddenly, you're taking 4 pills when the original problem was just your knee, which could have been treated with physiotherapy and topical analgesics. In medicine, we call this iatrogenesis, damage caused by the treatment itself. The danger is that each new drug introduced exponentially increases the chance of unpredictable interactions. The liver, which was already sluggish, becomes overloaded. The kidneys, which filtered with difficulty, can't cope. The result is a toxic, fragile body and a clouded mind, not because of the years lived, but because of the accumulated chemicals. The practical solution to break this cycle is the brown bag review technique. At least once a year, or whenever you feel something isn't right, put all the medicine boxes you take in a bag. Include everything: prescriptions, vitamins, concentrated teas, ointments, and painkillers you buy at the pharmacy. Take this bag to a private review appointment with your doctor or trusted pharmacist. Ask them to look at each one and ask, do I still need this? Could the dose be lower? Is this one interfering with that one? This simple act is an act of empowerment. It takes you out of the passive position of someone who merely obeys and swallows pills, and places you as an active manager of your health. Often when emptying the bag on the doctor's desk, you discover that you are taking 2 medications with different names, but which do the same thing, unintentionally doubling the dose. Or you discover that the medication prescribed 5 years ago for an acute crisis continues to be taken unnecessarily. Cleaning out this bag is cleaning out your body. By applying the knowledge of these 8 signs, you begin to chart a new course for your aging process. You stop accepting fatigue, forgetfulness, and dizziness as inevitable sentences and start seeing them as solvable problems of chemical adjustment. But how do you tie all this together and ensure you do it safely without putting your health at risk by abruptly stopping medication? Next, in our closing, I will explain exactly how to take the next step, what your mindset should be when entering the doctor's office, and how, by cleansing your body, you can rejuvenate more in months than you have in recent years. Real transformation begins with the decision to question and understand what you put into your body. We've reached the end of this conversation, and the message I want to leave in your mind is one of liberation, not fear. The thesis we've built together here proves that many of the ghosts of aging, the frightening forgetfulness, the limiting dizziness, and the depressing fatigue may not be the final destiny of your biology, but rather the temporary result of an imbalance in your chemistry. Health and maturity doesn't mean accumulating more bottles in the bathroom cabinet. It means having the wisdom to use only what is strictly necessary in the dose that your liver and kidneys can process today. Understanding that your body has changed, you gain the opportunity to adjust your routine to live more lightly. The rejuvenation you seek may not be in a new miracle vitamin, but rather in the courage to remove the excess that is obscuring the brilliance of your natural vitality. I want you to look to the future with optimism and realistic determination. Applying these steps is perfectly possible for anyone over 50, regardless of how many medications you take today. It's not about denying medicine, but about using it to your advantage, not against you. Imagine what it would be like to wake up tomorrow without that mental fog, walking confidently and feeling that your personality has returned to who you truly are. This transformation begins with a change in attitude, ceasing to be a passive patient who accepts any symptom as just a sign of aging, and becoming an active partner with your doctor in the pursuit of the best possible quality of life. You have the right to age with clarity, independence, and dignity, and the key to this is often detoxifying your care routine. Now, I have a very important request to strengthen our community. I want to know which of these 8 signs resonated most with your current situation. Was it the swelling in your legs, the mental confusion that seemed like dementia, or the excessive fatigue? Write in the comments. I will investigate sign number X. By sharing your experience, you encourage other people who are reading to not give up on seeking answers. And if this content opened your eyes in any way, check now if you are subscribed to the channel and have notifications enabled. We are building an army of mature and informed people, and I don't want you to miss the next video where we will talk about supplements that really work to protect your brain after medication cleansing. However, I need to be extremely rigorous in my final instructions, as your safety is my absolute priority. Never under any circumstances Discontinue the use of any medication on your own based solely on this video. Abruptly stopping certain medications, especially those for blood pressure and neurological conditions, can cause a dangerous rebound effect, leading to hypertensive spikes or severe withdrawal symptoms. The correct, safe, and efficient course of action is to schedule a checkup appointment with your doctor. Bring your notes, bring your medication bag, and say, "Doctor, I've learned about the risks of polypharmacy, and I'd like to review whether everything I'm taking is still necessary or if we can adjust the doses to suit my current metabolism." This frank dialogue is the most powerful tool you possess. Finally, I leave here an essential disclaimer. I am a researcher and screenwriter passionate about health and longevity, but this content is purely informative and educational. It does not replace diagnosis, advice, or treatment prescribed by qualified healthcare professionals. Each organism is unique, and drug interactions can vary from person to person. Use the information you receive here as a roadmap to guide your conversations with specialists, and not as a prescription for self-medication or self-weaning. Take good care of yourself, value your body, and remember, it's never too late to regain clarity and live your best years in full health. A big hug, and until our next meeting.